Hello everybody, nice to meet you all. My name's Jill Cadwgan. I'm a paediatrician in neurodisability, and we'll talk about what that is at the moment. My journey, I am in London now. I've been here for, horrifyingly, I've just realised it's 8 years. It's gone like a flash. I trained in Leeds, and then I moved via Edinburgh to Newcastle, and I was in Newcastle for about 15, 16 years, which is where I did my training. So I'm a London imposter, really, because my heart's very northern. I just wanted to really explain what a neurodisability paediatrician is. And it sounds really ridiculous because it's very clear-cut to those of us who work in it, but actually to lots of people, professionals included and colleagues included in paediatric specialties, they don't quite always understand what we do. So I'll just tell you a little bit about it. So what are we? We're paediatricians. Fundamentally, we look after children and their families. And we all have experience and training in general paediatrics. We have training in acute hospital settings, we have training in community settings. And fundamental to my practice is I always think to myself, first and foremost, as a paediatrician. I now work in one of the biggest neuroscience centres in the country, not Great Ormond Street, Evelyn London Children's Hospital, and I see kids with extremely rare and lots of children with much more common profound neurodisability. But fundamentally, 90% of what I do is I'm a paediatrician. I care about children and family. I see them from 0 to early adulthood. I generally look after a lot of their problems like tummy problems, constipation, reflux, chest problems, all of the things that are important on a daily basis to general health, but with this massive distractor of the fact they've got an underlying complex neurological condition, or they have a neurodevelopmental disorder, so they're neurodiverse. For any particular reason, they might have learning difficulty, they might have autistic spectrum disorder, they might have ADHD, they might have none of those things formally, but they might have different difficulties in all different areas of how their brain works. And this is where it fits in with brain tumour survivors who've had acquired brain injury from a brain tumour. So we also have experience of neurorehabilitation. A large proportion of my caseload is children with cerebral palsy. Their brain injuries happened before or at the time of birth. Another significant proportion of my population of children that I look after are children with complex neurogenetic conditions that predispose to brain tumours. So I work in the National Service for Neurofibromatosis, which presents often with optic pathway glioma in childhood and can present with peripheral nerve tumours elsewhere. I look after, and we manage these comorbidities. We think about the child in the context of their whole family, their environment, where they are regionally. And one of the things you'll hear today, and I've experienced because I have moved around the country, is every population is different. The very intense city populations in London are very different to rural populations in Wales, Cornwall, North of Scotland, etc. And we have to think of children in the context of their environment. And we're very experienced in working in multidisciplinary teams. That means that we work with lots of different professionals who come from a different angle. You've heard this morning from oncologists, from endocrinologists, from hormone doctors, from neurosurgeons. We can kind of work with those specialists that think of bits of children and try and think of the whole child in the context of their family. We listen to families, we listen to social workers, we listen to education professionals, and we try and pull it all together as a whole. Neurodisability has been 20 years, it shows my age now, I'm feeling very old. It's been 20 years since formal specialist training in neurodisability, and I was the second year it started. And it's existed for far longer though, because wonderful people like Jane Williams was instrumental for getting it recognised as a subspecialty. And it's 20 years since we're having a party actually in Sheffield in June, a gala dinner. You're all welcome to come, the British Academy of Childhood Disability, because it's 20 years old. So brain tumours and the developing brain. You've heard lots about, we've had lovely illustrations this morning about whereabouts in the brain the injury happens is instrumental to what happens to the outcome of the young person. But fundamentally, you have a subacute, so it's happening over a period of time. sometimes then precipitated into an acute event like a hydrocephalus event that we heard the patient stories of this morning. And then you have a sustained insult to the developing brain, because after that you have the surgery, you have the chemo, you have the radiotherapy, and you have the impact on life. You've got what's happening in the brain and the tumour and all the treatment we give. And then you have the interruption to normal life stages and events. So you have illness, uncomfortable treatments, hospitalisation, frequent appointments, impacts on school attendance, education, learning, socially developing. We heard such good illustrations. I don't need to talk having heard everything this morning. And it influences child and family relationships. Again, that was beautifully illustrated this morning by, trying to remember her wonderful name, and how Mum was so worried about her, and she didn't remember. Olivia.
Sorry. Could I just say, if you could name the microphone, it's much.
Oh, sorry. I talk because I'm animated. It's because I'm passionate. So if you think about this developmental trajectory, the line, the graph, the green at the top, and then suddenly at some point in your life you have this lightning strike of trauma and a brain tumour diagnosis, and then you flatten. Sometimes you even might go worse and down, and then you have to try and catch up. And actually most people never really catch up to exactly what they would have been, but they might be different. That line might go higher in different areas, it might go lower in different areas, but we're playing catch up. So thinking about brain tumours in the developing brain, I always like to think of us starting off as an infant, completely dependent on our parents, and becoming an autonomous adult. And all the way through that, we're learning. Our brain is like a sponge. It grows, it develops, it takes on information, it absorbs information, and it becomes, and you continue to learn. You develop relationships, you change relationships, you live your life, and you do your activities and you participate in life. And actually, at different points in your life, different things are important. So we all think about our growth motor milestones when you're little. Your first few years of life, you're doing your big learning. You're learning to walk. Then you're becoming an expert in skilled tasks when you're a toddler into primary school. You're developing your language and communication as you go through nursery and into primary school. But then when you get to secondary school, you've got to organise your books, you've got to carry everything around with you, you've got to remember your timetable, you've got to remember your homework diary. So your organisational skills are coming. That's your executive function and concentration. And then as you're a teenager, you're developing your identity, you're integrating with your peers, you're finding where you fit in, who's yourself. And your regulating your emotions, which are all influenced by hormones, all influenced by all the different processes that are going on around, within your own brain, but around you. So depending on when you get your brain tumour, you, as well as the site of where the brain tumour is, you are having impact at different times. And then after your brain tumour, when you're having to have your environment adapted because you've got all your hospital appointments and you've got other things going on, those sorts of social skills are really being impacted. And I deliberately carried the arrow on beyond becoming an autonomous adult, because I tell you now, I learn something every day. I learn millions of things every day. My brain is still changing. I'm still reacting to new situations. I'm still interacting with new people. My life is different now at nearly 50 than it was at 35 and it was at 23. So you don't just stop when you become an adult. You continue to grow and develop. And it's really important that the things that happen to us when we're tiny, tiny, tiny people, primary school, I remember my first day at nursery, like the back. I remember the trauma of being left there and having to run back after my mum screaming. You know, these things, what happens when you're a child changes who you are as an adult. And I just wanted, you've already seen this diagram because it was on this morning. The lovely talk this morning. So we think about health condition, and this is the one thing that is instrumental to training in neurodisability, is that we think a lot of our interventions as medical people is on the body structure and function. We're trying to change what's happening as a clinician. But what's most important to families is what they're doing with their activities, what they're participating at, how they're becoming a young adult. And that is hugely influenced by environment and personal factors. So the environment they live in, environment of being in a hospital setting versus being in a, carefree household for several months when you're in your childhood, hugely impactful. Personal factors, what's your underlying family background, what are your health beliefs, all of those different things that really, really impact on you. So challenges and opportunities, resources and commissioning. So I think we really need to think about, really, is it time? Yeah. Really think about is I heard the statement this morning that 20-fold increase in oncologists over the however many years. When I first, 20 years ago, when I went to my interview for Grid Neurodisability, there was about 7 posts available. There's still on average about 7 posts available in the country every year. So it's not expanding. We need resource for neurodisability paediatricians to support families. There's no doubt about the question that we need early support, and we need to support coordination of care between acute and community settings. Knowledge is empowerment for families and professionals, so knowing what the future holds is really important. And I actually think we've already seen it a million times before, but from adversity comes resilience. There's a really good prognosis now in terms of survival for children who've had brain tumours. And actually, it is absolutely possible to overcome your impairments to achieve full participation. And this is the group of people that can make a difference in the future, and we should be investing in them. So that's my little manifesto, maybe. Sorry, I've overrun.